This is Jeffrey Tucker, Brownstone Institute. Today we're going to be addressing a massive crisis in this country, for this country, which is, for all the world, looks like the collapse of the American medical insurance industry, which directly impacts the massive disruption of American delivery of healthcare. And it's the strangest thing because it's been happening pretty systematically since the passage of the ACA, more than a decade ago. I love the name, Affordable. What is it? Affordable Care Act. I mean, I guess you look at it from the Washington point of view. Whatever the bill is named, the actual effect will be the opposite, and it's never been more true than with the Affordable Care Act. Uh, I wish so badly I could go back to those days because I recall, like, just before the ACA passed, I had moved to my own private health insurance. And I was thrilled to finally get rid of being tied to employer provided health insurance because it limits your mobility, and anything that limits your professional mobility has a massive impact on your life decisions. I know so many people who just despise their jobs, can't stand their boss, are stuck in a dead end situation, can't get a raise, uh, just dream of, in a Walter Mitty sort of way, all the things they wish they were doing, but will not do it because of their health insurance. So I finally flung that beast off my shoulders and went to private health insurance. And I swear it was just a couple of months later that Obamacare was shoved through on a purely partisan vote in a brief moment of time where it was possible. And I wished I had kept this bill, but a bill came from my new insurer. I had maybe paid 2 months of premiums already at a really low rate, and and then I got this bill in the mail, and I think my new rate added a zero to it. I mean, literally, it was like it looked like a typo, like some sort of fanciful, what was like a joke. And I wished I could remember that. I wished I kept it. I don't remember the precise numbers, but it went from, "Hey, this is pretty good," to, "This is absurd." Absurd. I mean, I say 1 0. I mean, it might have been 2. I don't even recall. It was so outrageous, I just threw it in the trash, and, then went shopping on the exchanges and entered into the, strange world of of copays and deductibles and mandated, coverage, getting all sorts of coverage I didn't want for my mental well-being and preventative care and all this nonsense where, it looked like I was being forced to buy things I just didn't want. And then in the early days, the idea was that, if you didn't have health coverage, you'd be penalized for it on your taxes. Now that was struck down later by Congress, and gradually little pieces of the Obamacare ACA have been sort of pulled out, saving it for another day. But the big picture is still in place, which is these big packages of required minimum the benefits that you have to buy. There's no catastrophic coverage, and in fact, really none at all. Even that which is advertised as catastrophic still requires that you buy preventative care, even though there's no evidence that preventative care actually prevents anything. I was like, there's no evidence that you're healthier if you go in for routine checkups. Those routine checkups turn out to be basically sales funnels. And and the other big problem is the way that they assess risk. So the Obamacare model took actuaries out of the business of checking to see if you're healthy or not, and to check um, the the statistical likelihood that they'll have a payout, and remove that from individuals and put it into sort of a community risk rating, so that the unhealthy would share the same risk profile as the extremely healthy. And we didn't I mean, people didn't say this at the time, but it removed all incentives for individuals to stay healthy. And another way to put that is that if you went from unhealthy to healthy, which is, let's admit it, largely a matter of individual volition, there was no financial reward. This was for health insurance, for medical insurance, right? But that didn't pertain to things like life insurance. I mean, you're going to pay a much lower premium life insurance if you're a healthy guy, and you have to take blood tests, examine are you a smoker. I in fact, I'll just tell you, I bought some life insurance when I found out that I was going to be paying vastly higher premiums as a smoker than a non-smoker. I quit. Okay, that's the way it works. You know, like lectures from a pulpit only goes so far when it comes to your health. But when you have to pay a high price for being unhealthy and for not going to the gym, uh, for puffing away 3 packs a day or whatever, or drinking too much or whatever the thing is, or choosing to skydive and bungee jump, uh, when that comes with a premium that you have to pay, it kind of crystallizes things. So the pricing system works for things like life insurance and car insurance and homeowners insurance, which incentivize you to install sprinklers and put locks on your door or whatever. Uh, None of that pertains in the area of medical insurance. Anyway, I don't want to get off on a lecture on this topic because I'm so excited to bring in our guest today, who has rethought everything and actually done something of a miracle, which is to provide an alternative to the existing system that's on its way of collapsing. I'm so excited about this company, and I'm so excited to talk to this CEO, who, and I have to be careful to say his name right. It's Andy Schoonover, right?
You
So
got it.
welcome,
Schoonover. You got it.
Schoonover. Welcome, Andy. So glad to have you.
Thanks for having me. Appreciate it.
Your company is called CrowdHealth, and it seems to be the go-to place for people who are ready to try something completely different, rather than continue to pay the the same amount that their mortgage costs for health insurance they don't use. Um, I have so many questions. CrowdHealth. Let's just start with UL, because I want people to be able to go to the site. It's called CrowdHealth.
JoinCrowdHealth.com.
Yeah, joincrowdhealth.com. So if you have any questions about anything we discussed in this interview, your best strategy is just to go to that site, look at the videos, see if you. And by the way, I'll just be clear, because so many nonprofits do quid pro quos with the company. Brownstone Institute doesn't do that. So we're just meeting for the first time, but never had any industrial financial connection to CrowdHealth. I'm just super interested in what you're doing from a financial point of view, because we've got to develop these parallel systems sooner rather than later. And you seem to have figured this out and made a business out of it, which is so it's not like I just think about stuff. You're out there actually doing stuff. So it's really exciting to me. So I'm so happy to welcome you.
Yeah, I mean, I think oftentimes pain often results in action, or a change of perspective. I think that ultimately I came up with the idea because I had another healthcare company and I sold it, and I thought my only other option was the Affordable Care Act. So I went and I got a plan, and for me, my wife, and my two girls, I think it was $1,100 or $1,200 a month, and I kind of joke it worked until I had to use it. My little one, who was one at the time, was having recurring ear infections, so we went to the ear, nose, and throat doc, who told us that she had a hole in her eardrum, and we went to. He's like, no problem. It's a 15-minute procedure to get this corrected. We're like, great, let's do it. So we went in network. We did everything right. And, I get the bill from the hospital, and it was $8,000 for a 15-minute procedure. I was just like, holy crap, $8,000 for 15 minutes. Wouldn't we all love that, hourly rate? That's worse than my regulatory attorney's rates. But I thought this is why we have health insurance. Like, this is the whole point of having health insurance. Little did I know the insurance company was going to send me a note via snail mail, fun enough, saying it was medically unnecessary, and so they weren't going to pay for it. I went through two rounds of appeals, and despite the fact that my ear, nose, and throat doctor said she actually had a hole in her eardrum, they thought it was not medically necessary to get it fixed. And so I ultimately called the health plan. I was like, look, if you guys aren't going to pay my bills, I'm not going to pay your bills. And I quit. I looked at my wife and I said, we're uninsured. She kind of looked at me quizzically, as you can probably imagine.
Can I ask what year was?
Yeah, go ahead.
Okay, can you tell me what year?
This was it was 2019.
Wow, so yeah. CrowdHealth is that new?
Yeah, well, this happened in 2019. It took me, another kind of year to figure out how to actually do this. But ultimately, through that year, what I was doing through some research, and this is kind of first-person research, I started paying our own bills in cash. I was going to the doctor, and we were like, "Hey, we're going to pay you with a credit card instead of health insurance." And they're like, "Great, we'll give you 40% off." And I'm like, "Wait, what?" Like, I thought that these massive healthcare companies, United Healthcare, which is in the top 10 largest companies on the planet by revenue, would use that, power to negotiate really good rates. But in reality, what I found is that they put all this bureaucracy and middlemen in between me and my doctor, and therefore raise the cost to my doctor to get actually paid. And so the doctors are like, man, I don't get paid for 3 or 4 months. I get, reamed by United Health. Like, I'm willing to give you a discount if you'll pay me now. And we're like, great. So ultimately, the idea came. It was like, I wonder if we could get a group of people together, because I'm fine paying a pediatrician bill. It's $130. But what happens with cancer? Like, what happens with an automobile accident? And so if I can get a group of people together that could fund each other, so that I ultimately still have the cash to go and pay direct without a middleman, without all that billing fiasco, I could get significantly better rates than health insurance plans, which should drive the cost of that, quote unquote plan down significantly. And you know what? 50,000 bills later, what we have found is that our members are getting 50% better rates by paying direct than the large health insurance plans.
I remember when I first encountered something like that. It might have been, maybe it was 8 or 10 years ago. I was filling a prescription at CVS or Walgreens or something like that. And I can't remember if I had coverage or didn't have coverage, but there was some confusion at the cash register. Or maybe I did have coverage, but she couldn't. I forgot my card. She couldn't find it, something like that. And I said, well, what if I just pay for it without coverage? And she said, well, if you pay for it without coverage, it's a different price. And it was like half or even much less. It was something absurd. So the insured price was extremely high, but the cash price was extremely low. And I said to the lady, I said, what is going on here? Like, why would anybody pay the insured price rather than the cash price? She goes, well, that's because insurance pays it. Okay. This is the very definition of a scam. I mean, that became very obvious to me. So anyway, let's go back to your story here, because there's a moment in your story that was actually an act of kind of visionary courage to just drop your healthcare. There was a sense that you had that, okay, I am paying vast amounts. Did you tell me the number? It was
Yeah, it was 11 or 1,200 bucks a
Okay,
month.
so
I mean,
you're
I
paying.
went to the Affordable Care Act this year, and I would be paying $1,400 a month
Yeah,
plus an $18,000 deductible, which means I'm well into $30,000 before the health insurance plan pays a dime.
yeah.
And
So
so
this
you
is
can just do the quick calculus there and be like, what? Why am I paying $30,000 in when I'm a healthy family and all these kinds of things? It seems pretty ridiculous.
no, nobody in other countries can possibly even believe this. When I explain this to people, like in the UK or Australia or Spain or whatever, that the American system requires you pay, uh, you know, uh, up to $24,000 a year before you ever do anything, and then if you actually use that, then you're still paying more and more and more, up to tens of thousands of dollars before the insurance kicks in.
That's right.
And when we explain this to other people in other countries, like, how is this sustainable? This is crazy. This is the craziest system I've ever heard of. So you saw, well, you're throwing good money after bad. If you're going to pay for it anyway, why not just pay it out of costs? Especially when you found out that the costs of paying cash much lower. So you just said, "All right, honey, we don't have health insurance anymore. That's it."
That's right. Yeah.
And then the very
Yeah.
next question comes up: well, what happens if we get hit by a bus or whatever? Right. So it's always the same.
I mean, ultimately, we were in a financial position where we could figure it out. I mean, most people aren't, and so I think
Right.
the big question is like, okay, well, we could do this, but millions and hundreds of millions of other Americans couldn't do this if they came down with cancer or something like that, right? And so then the question is like, okay, how can we open this up to being cash pay, patients for the hundreds of millions of Americans, as opposed to the people who have the resources to pay for it if something does happen. So and in essence, I was self-insuring, right? Myself and my family. What would happen if we got, we now have 30,000 people who are a part of our community who can help out in the case something like big like that happens, so people don't have to, self-insure.
Yeah, so you're up to 30,000. That's a lot of growth in a very short period of time, I would say, for a completely alternative approach. I mean, so that's the very definition of success. I mean, really, it's just extraordinary. But this moment when you gave up the health insurance, so this whole reality has dawned on me slowly over time. But you're right. Here's a weird irony of this: the extremely well-to-do people, the people with the trust fund, the people with several generations of wealth, the people with a lot of liquidity, don't have insurance. And when I first discovered that, I thought, that is strange. So medical insurance is just for the hoi polloi, the slobs who can't, right? But if you get beyond a certain income level, you're like, well, I'm not going to participate in that scam. So it's weird. It's like the opposite, right? So extremely well-to-do people are not stupid enough to pay these idiotic premiums, whereas the middle class and the poor do pay them.
Yeah, I mean, anybody who can get into financial distress if they have, a torn ACL or something, right? Like, those people almost have to be into some kind of structure that helps you get those paid, or else you're going bankrupt. But I will tell you, one of the things I found during my research is that somewhere between 200 and 250,000 families with health insurance go bankrupt every year due to a medical event. So, while you have this instrument, this financial instrument, in essence, to keep you from going to financial distress, ultimately the plans are denying 1 in 5 bills. About 1 in 5 is the last, record from the ACA plans. And so you have a 20% chance of getting your bill denied. I got an $8,000 bill denied. I, fortunately had the financial resources to pay for it, but how many Americans have $8,000 laying around that they, if they get their bill denied, they're going to be able to pay it, right? Or even $15,000 deductible. Like, who's got $15,000 around to pay for their deductible? And so that was one of the big issues that or the two kind of primary issues that we saw was huge denial rates, huge deductible. Those two things together result in lots of bankruptcies, which I think is just a tragedy for a financial instrument that's supposed to keep you out of financial distress.
When so on your website, I was going through it, which I think congratulations to you for developing such a very nice website. It's a good pitch. But you make it really clear this is not health insurance. So when I've pitched CrowdHealth to other people, they say, "Yeah, but I want health insurance." They're clearly not health insurance, and so I have to explain. You need to understand that it's important for this company to explain to the subscribers that they are not insured so that they will very clearly and without a sense of shame or embarrassment or anything else go to the provider and say, I do not have medical insurance. And that statement, and you have to be able to like process that mentally, because we have this weird attachment to medical insurance. People
Stockholm syndrome or something.
Yeah,
I'm not sure what it is.
It's wildly irrational, but you have to train your people to be able to, with pride, walk in and say, I am uninsured, and then boom, the prices fall dramatically, and you get just the care you need without an infinite litany of, well, you should get this test, get this test, get this procedure, get this done, right? Because at that point they're actually pillaging you. But in other words, it's a moral hazard. Medical insurance, right? Having medical insurance is a bit of a moral hazard. You're going to get more,
Definitely.
more than you need, and you're going to end up paying for it anyway. But if you walk in uninsured, it changes the whole equation. Oh, let's get this guy what the services he's willing to pay for and get him out of here, right? So that's actually what you want. So this is a kind of a barrier for you, I would think.
Yeah, I mean, I think we actually have a T-shirt. I should have worn it today that says "Uninsured" on the front. We have it as a badge of honor. That it's like, look, we're making a statement here that we're not going to be a lemming. And sorry for all those who have health insurance, but you're kind of doing it because everybody else does it. And you've been conditioned since you were a kid that your mom's like, you got to have health insurance, or you turn 26 or whatever. Your mom's like, you got to go get health insurance. Like, it's just something that we've, for whatever reason, I think it's probably fear-based, a fear-based reason. We just assume that it's a necessary evil, and we've gone along with it. And so ultimately, like, I think many people who are listening to, the Brownstone Institute's podcast is like, I'm tired of going along with systems that I've been told in the past are there for me and to benefit me. I think we've seen over the last 5 or 6 years that there are a lot of systems out there that we thought were supposed to be for us that were actually against us. And I think health insurance is one of those. And I think it's just a matter of time before people realize that. And so, it's we have to educate people that it's like, this is okay. Like, you're gonna be all right. Like, this is not it's not like you're a poor person who doesn't have health insurance. Like, people feel that, like, there's some emotional component of this. We say, hey, this is a badge of honor, especially for your listeners. Like, this is a badge of honor to be like, I am saying screw that to a system that's scamming me. And I'm going to choose a different system that's right for me and for my family, as opposed to doing something that everybody just tells me that I should be doing.
But, Andy, I think what happens for a lot of people is that, yes, obviously trust in the system and all systems has just collapsed to, the minimum, right? People don't believe media. They don't believe politicians. They don't believe academics. They don't believe anybody. But it's one thing to just go around sort of being against everything, like Groucho Marx, in that movie, whatever it is, I'm against it, right? But it's something else to take that real step of applying this principle in your own life and just bailing from it. I got because you worry what's on the other side of it, right? I mean, this is it's weird. You're right. It's psychological conditioning. They think that if they have a healthcare membership card, that they've got healthcare. This is why people stay with their companies. They say, well, what are my benefits? Well, what if your benefits are not benefits at all? What if it's a ball and chain that's not conducive to your health, and it's not conducive to your financial well-being? I have a friend of mine, because I've been on this campaign now for, I don't know, for maybe just not that long, a few months, and a friend wrote me, and he's a highly intelligent guy, very up on everything, like knows the system's a scam or whatever. And he writes me a direct message on X, and he says, listen, I wonder what to do because right now I'm paying for my wife and my two children $3,500 a month for
Yikes.
but with that, I've only got whatever he said, a $10,000 deductible, and I don't know what to do. What do you think I should do? And I wrote him back. I said, "Are you out of your mind? What is wrong with you? You should not pay one more bill. Stop paying." He goes, "Well, that would leave me without a medical insurance. I don't know what I would do." And I said, "Well, you'll figure it out. If nothing else, you'll put that money in the bank and just develop a kind of savings, and then like you'll be fine. Just do it. You'll be fine. Just stop the madness. What is wrong with you?" So and he said, "Well, I don't know if I can convince my wife of that." So I haven't followed up with him. What did you do? But there's a weird psychology here.
Well, him and his wife and his 4 kids would be paying $465 this month with CrowdHealth. So he'd be saving $3,000 a month. So, that's a real cost that people are paying just because they've been told to pay this for 30, 40, 50, 60, however many years, right? So that seems like a very large opportunity cost to me. And so these people have got to get to a place of being like not so fearful and being driven by emotion, and let's add some logic into the equation. And we're trying to make it as easy as possible for people to make that jump. I mean, I think you made a really good point, and you've made it a couple times, which I love, which is, we're typically, our employer is quote unquote paying for our health insurance. But in reality, what's happening is you're paying for your health insurance through your deferred salary or your salary that you would have gotten. They have to pay health insurance for you. So, they're actually using your money. The line item on every P&L is salary and benefits. And so it's the same line item. If they didn't have to pay for health insurance, they could pay you more. So you are paying for that. And a RAND study came out 2 or 3 years ago that said somewhere between 2 and 4 million Americans would go and do something entrepreneurial if they weren't shackled to their employers by health insurance. And so that's un-American to me. I mean, I think it would be great to have 2 to 4 million more small businesses out there trying to go up the economic ladder. Instead, they have to get stuck with this, crappy plan at their employer and just suck it up and deal with it. Which it's just a tragedy. I mean, this whole employer-based system is a whole other conversation, but it's crazy that we still have an employer-based system, but ACA codified it back in 2009.
Yeah, I know it's a whole other conversation, but I do want to point out something. The bad guys who are running the system don't want you to have an exit plan from your employer provided health system, healthcare. I don't even. By the way, I don't like the word healthcare because it's not healthcare. It's medical
sick care.
Yeah. But so there are right now very few mechanisms, and the Republicans have done yeoman's work in creating some limited carve-outs that allow your employer to let you go and from their systems, and allow individual workers in companies with more than 50 employees to negotiate some solution with their employer to let them go. Okay, so that does exist. It's complicated. It requires a lot of paperwork. But here's the crucial thing. If you do that, the proviso is that the only alternative you're permitted is to go into the exchanges. In other words, you're not allowed to leave your employer. This is the current law. That you're not allowed to leave your employer provided medical insurance unless you can show proof that you're enrolled in an exchange based system of medical insurance. So you're not really free. I mean, you've been given a sort of a slightly longer tether. But in reality, there isn't really a way for anybody working in the United States in a company with more than 50 employees to leave medical insurance unless you can renegotiate entire salary and figure out a way to become a contractor instead of a W-2 employee.
You're totally right. Um,
That's
and
a
like I said,
scandal.
those it is a scandal. And it's a relic of all the way back in the World War II. It's early 1950s after the war. There was a wage freeze, and so these employers were trying to figure out how do you get people to join your company, and so they started offering health insurance, and so it was kind of a true benefit back then, because they couldn't pay you more in salary. And then that got codified into law over the last 60 or 70 years. First in the 1970s with the HMO Act, and then again in 2009 with the Affordable Care Act. And now, if you're over 50, you have to offer your employees, minimum essential coverage (MEC) is what it's called, or you will be fined by the U.S. government. I think it's $3,700 per year per employee, if you do not do that. And
This has
so
a profound impact on American industrial structures too, because I forget what the numbers are, but like more than 90% of American enterprises have fewer than 50 employees. But and I don't know what the alternative is, but most people work for companies with more than 50 employees. See what I mean? The difference there.
yeah, yeah.
Uh, but what it means is that for vast numbers of companies, they don't actually want to get more than 50 employees because then they become subject to this mandate. Uh, so they have every incentive to sell their company to a bigger company rather than bump up against that limit. I mean, there's a large financial cliff for the companies that add that 51st employee.
We had 49 employees in November of last year, and I told my team, I was like, we are not going to hire anybody until 2026, because I don't want to be in that position of having to provide health insurance. Now we have to figure it out for 2027, but it at least gives us a year to go and figure it out. And so
Wouldn't that
I
be
think, yeah,
ironic? That suddenly CrowdHealth has to offer its employees conventional health insurance.
we
Unbelievable.
probably ultimately will just pay the fine. I mean, is ultimately where I think we're going to go. But that's now a hit to my ability to provide services to my customers at a reasonable rate. So we got to work through some of those things. But yeah, I mean, it's definitely keeps companies from growing, which is kind of the core of America and their GDP generation, is these small companies being able to grow into something and to offer jobs and things like that. And so, yeah, I mean, it's a tragedy, but it's one of those typical things where people in DC think this is a beautiful idea. They've never run a business. They've never been in the market. And so they don't understand the second and third, impact scenarios of some of these. And they just, shoot from the hip a little bit and think they're smart. And ultimately it impacts, guys like me who are just trying to build a business and create jobs. But that's, I'll get off my pedestal, but I'm preaching to the choir, I think. But it's one of the tragedies of our current structure.
I think it's important to preach to the choir right now because the choir is tiny and doesn't understand this, which is one of the great mysteries of this entire subject. We've got unfolding before us a genuine calamity on a national scale concerning the funding of the medical system right now, and you just don't read about it. I mean, it's like it's hardly discussed at all in the public. I admire what you've done with CrowdHealth so much because you're not just saying leave your insurance, which is pretty much what I've said to everybody. Just forget it. Just walk away. This is stupid. But you've said, well, look, I'm going to provide an alternative. And you're not the only company that's doing it. I mean, I suppose there are maybe a dozen other companies, but they can be a little bit forbidding in the sense that they seem to be designed for particular communities, right? But
Yeah.
am I right about that? But CrowdHealth is for anyone who can look up and see if they're qualified or not. And you're going to save anywhere between 50 and 90% or more on the cost you would otherwise pay for conventional medical insurance.
Yeah, I mean, I think there's some. I got inspiration when I'm doing this from a lot of people. I can't say it's my original ideas. I mean, took some tweaks on it because I thought that some of the other things that people were doing just didn't make sense to me. But the Amish community does this. There's actually fairly large tribes in Kenya that do something like this. There are Christian health shares that do this. But as I kind of went through each one of them and how they were structured, I saw things that still continue to have perverse incentives in the system. And so I think that ultimately what I was trying to do is rip out the perverse incentives, because I think incentives are everything. Regardless of how hard you try, the tide of incentives will just take you out if you don't make sure that those incentives are correct. And I think that one of the key ones that people don't fully understand, and people are like, healthcare is so complex, and I was like, look, it's not that complex. You've got the sellers of healthcare, which are big hospital systems. They want the price to go up, but very few people understand that the buyers of healthcare, these health insurance plans, they also want the price to go up. Because what happened with the Affordable Care Act is that the insurance providers can only make 15% in profit of your premium. So if you have $1,000 of premium, they can only make $150. These are for-profit companies who are trying to grow their revenue. So how do they grow their revenue? They're by 10%, let's say. So their profit can go from 150 to 165. Your premium has to go from 1,000 to 1,100. And so they actually make more money as premiums go up. And that's one of the main reasons why they don't take a very hard negotiating tactic with a lot of these big hospital systems, because it's oligopoly versus oligopoly. And typically just within economics, if you have oligopolies fighting against each other, a lot of times there's kind of a wink, wink, let's both get a little piece of the pie, or else we're going to have self-destruction. And so that's what hospitals and plans have done every year. They winked at each other and like, hey, give me 5, 6, 7% rate increases, and we can pass that on to the regulators at the state. They'll approve of it. And so 5 or 6%, which other than the last 4 or 5 years has been 2 or 3x, the CPI rate. That's no wonder why healthcare is growing at CPI times 2 or 3. So that's the incentive structure within healthcare currently. So we have no market forces who are trying to push those prices down. All the market forces are trying to drive the prices up. And so that's where we've gotten, $5,000 MRIs from, ultimately, where if I went and paid in cash, it would be 400. And so that's why we are where we are, is the incentives are screwed up within the system. And that's why we've changed the entire incentive process within CrowdHealth. So you also ultimately have to treat other people's money like it's your money. I've got this whole debate going on X right now around, transparency is really interesting. But I think transparency is only valuable if you have an incentive structure that enables you or incentivizes you to shop. So, if you have a $20,000 ACL reconstruction and your deductible is $5,000, you don't care if that ACL reconstruction is $20,000 or $50,000. So you're not going to go and shop for that. Ultimately, we've created some incentives in place for people to be like, hey, look, if you go and get the $50,000 one, there's a one in your city for $20,000 and the doctors are equally good, then the community should know that you went to the $50,000. And that's probably not going to be well received by the community. So we've kind of tried to disrupt some of those perverse incentives within our system. And it just aligns everybody, which I think just makes the process way, way better.
Since you mentioned CPI, I can't help but point out that all the cost increases, price increases that you're mentioning are not incorporated as part of the CPI. The CPI calculates the medical spending and health insurance with a completely different formula that makes no sense whatsoever. They're not looking at how much you have to pay. They're looking at how much you consume. So if you don't consume any, then they consider your prices haven't gone up at all, actually. And so it's this crazy cockamamie formula designed to disguise how much it's gone up. So I'm trying to think of I want to get into the mechanics of how your system works, but I'm trying to think about let's address the most obvious issues first. But so somebody's now a subscriber to CrowdHealth, and you're paying, let's just say for a healthy individual in his or her 20s, you're going to be paying like $100 or $200 a month. Is that right?
That's right.
Yeah.
Yeah. Well, we have an interesting structure, just real quick, and not to get into too deep into mechanics, but I think the incentives are really important. So we actually have we bill you twice per month. The first is $60. It comes to us. That enables us to pay our bills. So the only way we make money is a subscription. Health insurance plans make money by premiums in the door, medical claims out the door. They take the difference. which again incentivizes premiums to go up and claims to be denied. So those are some really, for us, it's a subscription basis. So I want you to stick around. I make more money if you stick around. I'm okay saying that to everybody. And so we want to treat you well. We want to get your bills paid. We want to treat, that it just seems like a normal, consumer company relationship. And then for that $60, we have a negotiations team. So we have an entire team of people who will negotiate bills for you. So you don't have to go through the hassle of that. When you get bills in the mail, all you do is upload them to our app. Our team takes care of it. We evaluate them. We negotiate them for you. We do all of that for you. You also have a personal care advocate. So one of the things I hated with health insurance is calling to India, United Healthcare, and, is being on the line for 20 minutes. And then somebody there tells me it's the wrong department. They have to pump me to somebody else where I have to tell my whole story again, wait on the line for another 20 minutes. I mean, it's crazy town. So with CrowdHealth, you get your own personal care advocate. So every time that you call us or you email us or you text us, you're talking to the same person. They get to know you. We get to know them. That's really important. So that's the $60. Then we will charge you up to $140 if you're a single person. And so the two together is a max of $200. The important part of that $140 though is we only ask what the community needs that month. So if the community needs less than $140, then you get to keep the difference. With the health insurance plan, if the community does well, the health insurance plan benefits. So this month we're only actually asking 75 of the 140. So 75 plus 60, if my math is right, is 135 for an individual in June for CrowdHealth. Somebody would be paying $300 to $400 with a $5,000, $6,000, $8,000 deductible, something like that, with the Affordable Care Act. And so it's massively less expensive than your alternatives.
And so the more subscribers you get, then you're going to expect that second, crowd fee to fall, right?
It has. We're down somewhere between 5% and 8%, depending upon the kind of the level you are. If you're a family or single, but we're down 5% to 8% over the last year. I think the Affordable Care Act plans were up 10% or 12% or something like that year over year. And so we've been able to drive costs down. The other really important part of this is, I know you have smart listeners who I think will understand this, but like the more people we have, the more bills we get. The more bills we get, the more cash pay prices we get, which are substantially less than health insurance plans. We give those prices back to our members so they then have access to those really low cost places to go. So if I need a cardiologist in Austin, Texas, somebody in Austin, Texas from the community has gone to a cardiologist. They know what the prices are because we have the bill. We know if that cardiologist is really good or really crappy or whatever. And so it's almost like crowdsourcing cash pay prices in your area. And we give that direct access to those prices to our members. It's really easy to shop. All I have to do is go in the app and say, I want a cardiologist in Austin, Texas. And it will give you all the cardiologists, all the prices for right there in your app within 30 seconds.
Unbelievable.
And so that's the flywheel of data that's really going to be able to enable us to drive prices down significantly and bring free market forces into the market, right? Exactly. You're actually shopping based upon what the price is. We also have some quality data there too. So we're saying like, hey, this cardiologist is better than this cardiologist, or this OB has 7 times the number of C-sections as this OB. And so we can give you actually data to show you that, this doctor is better than that doctor, or they're equal. And so it's not like we're asking you to go to a cheap ass doctor who's really, gone to a fourth level, medical school. It's like, no, we've actually got quality data to show you that this doctor is just as good as this doctor, and they are half the price. And so we're trying to, again, I've said it 10 times probably, but it's so important to me, is bringing market forces into healthcare because they're non-existent at this point.
And do your members talk about medical tourism? Like, well, I went to Indonesia for this. I went to Albania for my whatever, Mexico for my dentistry. How do you handle that?
Yeah, I mean, I think that ultimately what we've found is, and we've talked to a lot of these international tourism places, and if you compare the international tourism prices to health insurance prices in the United States, it makes tons of sense. if you compare them to cash pay prices, it's not that big of a difference, especially when you think about travel and all that kind of stuff. So, I know, Oklahoma Surgery Center. Oklahoma Surgery Center can do it for as inexpensive as the guy in Mexico who does it. And you've got U.S. doctors, U.S. trained, all these types of things. And so, go to Oklahoma as opposed to, Monterrey, Mexico. I think it's just as good. Now, it might be marginally, more, but not enough to say fly to Monterey and stay there and recover there and all that kind of stuff. And so the vast majority, 99.9% of our people decide to stay in the United States. And so it just makes more sense.
Oh, now there are things that are listed on your website that are, what would we call them? Like known scheduled high expenses for which you also charge premium. I'm thinking in particular of pregnancy. So, so you've got a one-time, I think it was $3,000 fee. So you want to have a child, they're going to be paying you $3,000, after which all the bills from the hospital are sent to you. Because that's rather expensive, right? But so, and the problem not the problem, but the issue of pregnancy must figure fairly high in your economic calculations. What does it cost the typical couple or woman to go from, okay, here's my positive pregnancy test, to now the child is born and out of the woods? What would the normal figure, the insured price of that be? Do you have any estimates of that?
Yeah, I mean, if you include prenatal, birth and delivery, and then postnatal, it's somewhere around $20,000 to do that. Our deliveries, the same time frame is around eight or nine, and so it's half of what they would be. And so, look, I think pregnancy is a hard one, right? And 30% of our money from the community is going for pregnancies. I kind of look at this as it is kind of in the vast majority of cases, an elective thing. I think everybody knows how this works nowadays. And so, you got to have a little bit of skin in the game, or else what would happen is adverse selection. Everybody would come to CrowdHealth, get their baby for free, and then, bail afterwards. And so we needed to have a little bit of like, hey, you have to put some skin in the game. If you're with a health insurance plan, you would be paying the first 6, 8, 10,000, something like that. With us, it's 3,000. And so we think 3,000 is enough for people to be like, okay, I'm putting in a little skin in the game. And what we have found is that those families actually stay with us for a long time. So while the community is subsidizing them in that year, ultimately, the way we've kind of looked at it and calculated it is over a period of time, given that the amount of healthcare costs for it, a 1-year-old to a 26-year-old is basically zero. Like it's just not a lot of healthcare costs there. They make it up over time. Most of us, we're subsidized. If you're born into the post-insurance era, so, post 1973, let's just say, somebody else subsidizes your birth. I mean, it just is what it is, and so I'm okay with subsidizing other people's births. I'm a pro, birth kind of guy. Let's populate the planet. And we just love having families as a part of the community. So I think it works out in the end. I think just in the short term, it is a subsidization of pregnancies. Pregnancies are number one. Injuries are number two. So it's people out being active, tearing their ACL, mountain biking face plants, but they're being active. And so I love the fact that I get to pay for babies and, those types of accidents because they happen to my family. It's the things that like chronic conditions, especially when they're lifestyle related, that our community doesn't like paying for. 25 cents of every dollar right now is going to somebody with diabetes. And the vast majority of that, 90% of it, is type 2 diabetes, which is a lifestyle issue. It is what you eat. And so, our community doesn't love doing that, paying for those types of things. And so, that's why we have kind of a wait period. If you have a chronic condition, you have to pay for your own chronic condition for the first 2 years. And then, you are a part of the community. We will welcome you in after 2 years and help you pay for that chronic condition, but you got to own it for 2 years. And that's kind of the middle ground that we were able to figure out to help some of those people, but say, hey, a lot of that personal responsibility is on you as well. So it's the design of the in insurance world, they would call it the plan design. And, in our world, we just call it like, hey, this is how we want to build a community to have the same worldview as us. And, we've got 30,000. We had 10,000 this time last year. So we went from 10,000 to 30,000 over the last year. And we've, really found a group of people who this resonates with and, are okay with some of the limitations. And, it's a fun community to be a part
of. In setting up your company, how much time did you spend poring over actuarial tables, and where did you get them if you did?
None.
Well, this is all just intuition you have? I mean, you surely must be looking at data.
Yeah, I mean, the data we were looking at was, if I think I can get if I think I can get 50% better prices than health insurance plan, which is what me and my wife were seeing, and others that I talked to. I talked to a lot of people who are doing some similar stuff. What would the price have to be? And so we kind of just winged it up front. And I'll tell you, like, for the first 1,000 members, when you ask entrepreneurs what keeps you up at night, that kept me up at night. Did we hit this right? And in fact, we overestimated when we first started what it would cost. So I was trying to be conservative. And so those costs have gone down. Our price today in June 19th of 2026 is significantly, probably 20% lower than what we started with in 2021.
That's
so
amazing.
We're down something like 20% plus or minus over the last 5 years.
But your intuition told you, and I'm asking you, I guess, based on is it just stemming from your own sensibilities, or did you have actual data? For example, you don't want tobacco smokers, right? Sure. So if you're routinely puffing away, actually, I think it's even more strict than that. It's like if you are a smoker, like, so you go camping and your friends want to light up a cigar from a box. You don't want a person who's going to participate in that because you believe that is an unnecessary risk for long-term catastrophic damage to your body. Is that correct?
We're not that strict. It's a daily smoker. So if you are a daily smoker, then we are not interested in having you as a part of the community.
Got it.
I mean, I'll smoke 2 or 3 cigars a year with my buddies. I don't think that's a big problem. We're not super strict on that. But it's just the daily usage of tobacco products is the issue that we have. And it's ultimately, it's a personal responsibility thing. I don't think anybody should be responsible for your lung cancer if you, if you smoked, if you're a smoker. Like it just doesn't make any sense to me.
Aside from lung cancer, I mean, I was a smoker from the age of, from like as soon as I could escape my household, it's like, what is the first thing you do? You buy a pack of cigarettes, right? And I smoked for decades. I mean, just like routinely, I just couldn't give it up. And the only thing that caused me to give it up was when I looked at the life insurance premiums difference, and I thought, God, I hate this crap, and I gave it up instantly. I lost mentally the desire. And far from being, I know it's supposedly addictive and blah, 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 but actually I never smoked again. I mean, that was it. I looked down at this pack of cigarettes. But the other thing is it's not just the cancer risk. And for a lot of smokers, the idea that, for 1 in 10 smokers, it's going to increase your cancer risk by such amount, right? That's a little abstract, and you're willing to take a risk. Like, maybe I'll be one of the 9. But the real problem with smoking is and nobody says this, but it's other things. It's chronic bronchitis. It's all the organ failures that come to you by virtue of having clogged up your lungs with tar. And so you're
cardiovascular.
Cardiovascular. You're not getting oxygen to feed, the thing that makes you live. So it's a disaster. I mean, like even if cancer weren't part of it, smoking is a health disaster. You discern, in a medical disaster for anyone. A daily smoker is doing no favors to himself, just hardcore. That's just the way it is, and you don't want the community to pay for that. So if you want to join CrowdHealth, got to kick the habit, and actually saving, a couple $1,000s a month is maybe enough incentive to do that. The other thing that that stood out to me was, I think you do have a pretty hardcore, like get on the scales and make sure you're not obese, right?
Yeah. If you are obese, then again, I think there's been a lot of debate in the media of this around the last 3 or 4 years, especially. We just don't think that you'd be a great part of our community. Obesity drives up healthcare costs by 3 to 4x. It's another reason why our healthcare costs are so high is we have so many obese people in this country, 50% more than other, first world countries. And it drives healthcare costs up. And so I don't think that people should have to pay for the increased cost associated with obesity. That's just ultimately where we came out.
So, Andy, I know you know this, but I just want to say this for the purpose of this podcast. Look what you've done already. I mean, even if a person does not join CrowdHealth, your very existence provides a sort of a desiderata for any individual that is pursuing really bad lifestyle choices. An obese person that just can't stop eating a gallon of ice cream a day and ordering the extra large pizza and pigging out on it in front of Netflix while slugging down 2 6-packs of beer. Right? This is a bad way to live. Okay, so now because you exist, this person is now aware that they are paying out of pocket $2,000 a month and maybe facing catastrophic bills because of this choice, right? So you've already built into your very existence builds awareness that doesn't currently exist in the system without these CrowdHealth options. You see what I'm saying?
Yeah, absolutely. I mean, we even go one step further. If you're a member and you can show us that you're metabolically healthy, we give you another 20% off. So, car insurance, if you're a great driver, you get a lower rate than the bad drivers. If you're with your health, if you're a good driver of your health, you should be paying less than those who are not good drivers of your health, or even mediocre drivers of your health. And so, you can join CrowdHealth. You can take 3 tests. It's a visceral fat test, which is like how much fat are hanging out around your organs. You can take your fasting insulin, just as how much insulin is hanging around in your blood, and a C-reactive protein, which is kind of the closest thing that we can figure out for inflammation in your body. And if you can show us that you are, very healthy on those 2 of those 3 levels, then you can get a 20% discount off of CrowdHealth. So we've had many situations, many situations in which people couldn't join CrowdHealth. They got their act together and then they joined CrowdHealth. I have a guy who reached out to me multiple years ago. I was like, I'm really pissed off that I can't join CrowdHealth because he was 300 pounds or something. And he emailed me, or he actually was on X. He sent me a DM on X like 2 years later. And it was him and his wife at the end of a triathlon. They were now down to 200 pounds. And they were new CrowdHealth members. And so I'm like, awesome, brother. Like, that's amazing. Like that you made the lifestyle changes to be a part of this.
Yes.
And, same thing with CrowdHealth. Like we're now giving them the tools to understand their metabolic health. And we'll give you a discount if you can get there. So, people before joining CrowdHealth had no idea what fasting insulin was or what visceral fat was or things like that. And we're like, hey, these are the important things. So that when you're 62 or 65 or whatever, when you go into Medicare, you don't have the 2.5 or 3 chronic conditions that the average Medicare, entrant has. Like that's where we're really going to be able to change the system, is educating people on what matters, what can you change, what metrics, because what you don't change is never gonna, or what you don't measure is never gonna change. So you got to measure those things, and those are all those tests are eligible for funding through CrowdHealth. So we're not even making you, ultimately pay for them. The crowd is paying for them, but we think that the return is going to be getting people on that lifestyle path. That's going to lead to much less chronic disease once they hit that 60,
Isn't
70
that
ages.
remarkable? You've brought together what Obamacare broke, and it seems incredible to say it, but Obamacare broke the connection between your lifestyle choices, what like the decisions you make, and what you pay for medical care, which is crazy. And when you say it that way, it's not at all a surprise that since the ACA went into effect, American health has fallen off a cliff, right?
Mm-hmm.
When you do this kind of thing, it's like, I mean, you can create any kind of catastrophe simply by changing the formulas that go into the premiums. If Congress passed a law that said from now on car insurance can no longer um, charge people different rates based on their driving record, within a day, the highways become vastly more dangerous. Actually, every road would become more dangerous. So, and people understand that when you say that, yeah, that would be crazy. That'd be a crazy system. Well, that's the system we've adopted for
Yeah.
medical insurance. And
My
so,
average speed would go up by 10 miles per hour tomorrow if my health insurance or my car insurance didn't care if I got pulled over by a cop. I don't care about the $80 or $100 ticket. I care about the health or the car insurance going up on me next year. So that's the reason why I don't pedal to the metal. I think again, it's back to what we've been talking about, which is incentives. Right?
yeah,
We
so
got to
brilliant.
align incentives in healthcare,
We've
and
got to do it.
it's actually illegal for health insurance providers to give some people better rates than others based upon their health status. That's
That's right.
illegal. Like,
That's crazy.
It's crazy to me.
Yeah. So as a result, we've reduced um, uh, the decision to be healthy to almost an abstraction. It's like get out there and run and exercise more and eat right. It's like it just becomes this white noise if it's not backed by any actual rewards beyond
Mm-hmm.
just personal vanity. Uh, this is an insane system. So it's like congratulations to you that you you broke through this with actually what strikes me as the one real answer, which is something that I think the Maha, so-called Maha movement, needs to come to terms with this. Like we need actual system reform. Is that we don't,
Mm-hmm.
sermons uh, and slogans and pictures of pyramids, only go so far until we
Yeah.
have actual options that connect people's individual choices with the financial underpinnings that unite those things together. That's when it clicks. Okay, I suddenly want to be healthy again. Can I ask you? I mean, you're so clear and so brilliant, and again, I admire you because you're
Can I
not just
record this for my wife? Let me
no
record
no.
this for
I
my
mean,
wife
like
real quick.
no, I admire this so much because you're not just an intellectual, right? I mean, you're out there doing the thing, which is just the hardest thing if you've never started a business and seen a need in the market and taken the risk to get out there and do it and united your ideas with a kind of rubber meets the road plan. It's amazing. What was the background to give you the knowledge to see all of this and act upon it? Was it in finance or was it in medicine?
Oh, I'm a finance guy. Yeah, I'm a finance guy. I mean, I think that most great innovations come from outside the industry. I mean, I think that people in the industry get so indoctrinated into this is just the way it's done. I think oftentimes we get people from outside of industries jumping in and being like, why? Well, why does it have to be done that way? And so I ask why a lot, probably more than a lot of my people, at CrowdHealth, like, but I'm like, why? Well, why do we have to do that? And if it doesn't make logical sense to me, then we just question it. And so I'm a finance guy, and just came into this by luck, or chance or divine intervention or whatever it may be. And I have just always been one to be to question what everybody else tells me. My mother probably didn't love that for the first 18 years of my life, but I'm always questioning authority and questioning why we have to do certain things, and trying to use some logic to get to kind of first principles. And I think that we're doing that within healthcare. I mean, we're not perfect, but I think that we're making leaps forward versus what health insurance is, and I think that's just the background. Don't probably some psychology from my childhood or something that I should look more into, but no, it's more just kind of being curious about why these things work the way they do.
And partially, I think, when I look at the legal environment out there, because people listening to this might say, "Geez, how does he get away with this?" But don't you think there was a decision by Congress, and I think it was considered by the Supreme Court, that you cannot have the mandatory subscriptions on Obamacare, which it started with, right? Everybody had to be in the system, or else you're penalized for your taxes. And I think Congress, and maybe the courts backed it up, I'm not sure exactly how this happened, said, no, okay, that's really a bridge too far. So that's what carved out an opportunity for you. So people still have some options to leave the system, and that's what created this opportunity for you.
Yeah, Obamacare had an individual mandate in 2009 that got overturned in 2019, and so there's no federal individual mandate that you must have health insurance, and so that has given us an opening. And now, look, I mean, I think we're in this place, and you started this by saying, the health insurance system, I forget exactly the words, was kind of in this death spiral, if you will. It's kind of towards the end here. We're seeing these massive increases. I think we've got one of two ways: whether we have to innovate our way out of this, which is what I'm trying to do, or DC is just going to take over and it's going to say Medicare for all for everybody. And I hope we go down the innovation route as opposed to the Medicare for all route. But we're going to be here until the laws changed. And yeah, people are probably asking, like, how does Andy get away with this? I will tell you that we spend a big chunk of money on regulatory attorneys every month, unfortunately, because a lot of these states, especially the blue ones, don't like what we're doing. And they insist that we are health insurance, even though we say we're not health insurance. And so far, through a half a dozen states, most of which are blue, who've approached us, we've won that battle. Every time that they've come to us, because we can prove that the fundamentals of health insurance is not what we're doing. People as uninsured members, our members are the ones that are ultimately responsible for paying that bill. With a health insurance plan, the health insurance plan, guarantees that bill gets paid. Like, they take on that liability. And so that is the key kind of thing that keeps us from falling into insurance world. And then the other thing too is we don't have any pooling of capital on the back end. So it doesn't all go into one account and then it's pooled and then the funds are paid out of that. Ours are peer to peer. So if Jeffrey broke his arm, Andy would send Jeffrey for my family, it would be $240 this month. And then at the end of the day, Jeffrey has enough money in his bank account to then go and pay for that broken arm. So it's a peer-to-peer transaction. It does not go through CrowdHealth, which is kind of an interesting component of this that we haven't really talked about. But I think it's cool because every month I get an email from CrowdHealth saying, this guy in Austin, Texas, or wherever broke his arm. Will you help? And I say yes, and my money goes directly to that person. So I know what my money is being used for this month. It's not going to United Healthcare, which it could be used for, the CEO's jet or whatever. It's going directly to another person in the community to help them. And that's a really cool thing. I mean, I'm excited to help somebody out every month, a maternity case or a cancer case or whatever it may be. And so that creates that really strong bond within the community, knowing that other people in the community are helping me directly. It's not through an intermediary. And so therefore it's less expensive and it's direct. And so it's just a really cool component of what we do that's vastly different than health insurance.
Here we are 6 months into 2026, and 2026 has been a disastrous year for the American system of medical insurance and medical payment provision generally, because the premiums have just gone up and up and up and up. And we all know
Mhm.
that it's very difficult to measure precisely how much, because it's different for every single person, and the fees and the charges and the expenses are hidden in various weird ways that nobody can really understand. All you really know is that the system is exploitative and
Mhm.
parasitical, and you're not getting your money's worth, and vastly overcharging you. And it's strange because if you've got health insurance and you don't really use it, you don't, like, you've learned since the COVID years, don't go to the doctor. There's trouble there, right?
Mhm.
Which a lot of people have.
Mhm.
But then you find that you have to use it. You will find yourself shocked and appalled and outraged at what they will do to you. Denied claims, hidden fees, outrageous expenses on diagnostics that you didn't need. Like every possible reason. Like, you get annoyed when you go to the restaurant and they've got a special fee for for piping in music and whatever, and for the dishwasher. Okay, that's annoying. I mean, healthcare is like 1,000x over that, right? So,
Mhm.
but people are becoming aware of this. Like even now as we speak, I get the sense that the situation is much more um, like on the verge of complete disaster. In fact, I think you might have data for us this year. I think I read that uh, somewhere between 1 and 2 million people have already left uh, the exchanges. Am I right about that?
Yeah, I think it was 2.5 million. Those the last numbers that I saw. I mean,
Okay.
ultimately, what happened last year was, we had this supposedly one-time subsidy for the Affordable Care Act plans that was done during the COVID years, which is supposed to be a one time. We're going to help you get through COVID, and of course, in DC, nothing is one time. Once you give somebody something, it's really, really hard to take it back. And I fortunately for us, that those subsidies were ended at the end of the last year, and so people's premiums went up, skyrocketed, in some cases 100 or 200%. And so I think people at that point kind of was like, what are there alternatives? Like, what are the alternatives out there? And they found us, and we provide them a way not only to not see your bill go up, your bill actually from last year went down. And so people are really, really excited about it. And so that's what has kind of propelled the growth over the last year, especially is these ending of the subsidies. And I think we've gotten to a place too where, would you join something if it's different, if it had 1,000 customers? What about 5,000? Now we're at 30,000. I think most people are like, okay, like this is legit. Like this is a different way of doing it, but it's legit and it's working. And I think a key component of that is we are like ultimate transparency. And so we put all of the bills that we got in online. So you can go and look at them and you can see what they were, how much they were for, whether they got funded, whether they didn't get funded. And so we're like, we know we have to build trust with you. We're going to be transparent with you on everything that we do. And I think that's just the right way of doing it. And I think people have finally come to the conclusion of like, this is a legit way of doing this. That's way, way better than what I thought was my only alternative, which is health insurance.
With people leaving the exchanges, so that people understand, I mean, this is a disaster for the system in some ways, because the whole thing relies on maximum participation. So as people leave, and typically the people who are leaving the risk pool are the people who are the healthiest people, and leaving the Obamacare risk pools with the least healthy people. So this guarantees, is it like premiums are going to skyrocket, month by month, year by year. It's completely unsustainable. Uh, uh, I'm so excited for people to watch this and listen to it. It's going to be fantastic. I think for a lot of viewers, it's the first time they will have even heard that there's an alternative to the exchanges or to mainstream medical insurance. So I think you can prepare for an onslaught of inquiries
We
and
love it.
questions. Let me ask. Let's finish up with this one question, because I think this is really what it really comes down to. When people join CrowdHealth, have you heard or seen reports of a change in outlook towards life. Like, so on one hand, you feel strangely free of this beast, called conventional medical insurance, which which is sort of emancipating in one way. And then on the other hand, you feel a new control over your life, a new incentive to live in a healthy way. Like, what kind of impact do you think your company has had on people's lives directly?
Yeah, I mean, I think that. Well, I mean, the first, and this one is the obvious one that I can actually measure is financial. Our members have saved $80 million over the last 5 years. That is money that they wouldn't have sent to the insurance plan that they're now being able to hold and do with what they want. We put something up on X the other day. If you had started with us in 2022, if you're a family of four and you started with us in 2022, you'd have $70,000 more in your pocket today than you would have if you were with health insurance. And for most people, $70,000, that's a lot of money. That's a lot. That's game changing money for a lot of people. And so people are saving a ton of money. And then I say, that's the data we can measure. The data I can't measure, which is much more anecdotal, but I hear it all the time, is I think exactly what you said, which is people feel like they have more healthcare autonomy, more sovereignty over the outcomes of their health. Like, once you give somebody that responsibility, like, hey, your health is not your responsibility, I'm not going to outsource it to a health insurance plan. I think people just take a renewed kind of view on chronic conditions and taking care of themselves and things like that. And then us giving them the tools to, like, say, hey, these measurements do dictate or kind of determine where you're currently at. Like, people can start measuring them, and like, people really love that. They're like, oh man, my visceral fat level, last year was 3 pounds. This year it's 1.5 pounds. I really want to get it under 1 pound next year. Right. And that's now a lack of fat sitting on your organs, keeping them from doing what they're supposed to be doing, all because you're just taking a less than $100, test. And we think that's going to result in, significantly less chronic conditions. And so I think, I think our people are getting healthier, not sicker. And so that's ultimately where we should be pointed in this country. And I agree with you on the Maha movement, by the way, earlier. Like, it's fine sprouting out about eat healthy, but like, it just doesn't resonate with a lot of people because they've been hearing eat healthy their entire lives. And maybe you want to redefine what healthy is, but I think they need to be incentivized to do so and feel it in their pocket. And that's what we're trying to do. And it's been, super, super successful. So we're fired up. And, I think, we'll probably have about 50,000 customers by the end of the year. We're hoping to have, 250,000 in the next couple of years. And so I think this is, just starting to ramp up.
I'm so thrilled that we've done this. I love the gamification of health. It's a very interesting concept. But yeah, united. So forget the sermons. Here you've united real health information that's verifiable and true with the data and statistics, and it's actionable in the sense that it's backed by the reality of the numbers and the finance, and free. It redounds to the benefit at multiple levels of individuals, not just financially, but it makes them healthier, makes them happier. It makes them freer. So, and what's that worth? That's worth a lot.
Amen.
So, Andy, thank you so much for spending this time with me. I'm so excited to get this thing out there, and let's stay in touch, my friend.
Thanks so much for having me.
Okay.